Hi, just coming to you. I got a total knee replacement done on Monday, May 5th. So today is the 8th, so 3 days ago. I feel pretty well. I feel like I'm doing pretty well. Just really following the regimen that has been suggested, which is basically a lot of icing of the knee, a lot of elevation above the heart, getting up at least once an hour to use the walker. As you see, I have a walker right now to walk around, and going to PT. I had 2 sessions of PT so far, which were pretty good. I did have a little bit of a setback yesterday. I had a little numbness in my leg, but I had the opportunity to talk to the surgeon, and he assured me that it was just part of the issue with the nerve block that hadn't worn off yet. So that was quite reassuring. Anyway, we're sitting outside on the porch. One of the cool side effects of this is that we're doing some stuff around the house to kind of make it look really nice for the summer. And Jerry's just building a bench today, and he was doing a little gardening center out back. So we're excited because we're going to be home a little bit more this summer. Everybody has been wonderful, and wonderful with a capital W. I feel quite blessed. So I wanted to make these videos though, because before I had my knee replacement, I watched a lot of other videos. I'm a nurse, and I watched a lot of other videos, and some were really helpful, but other ones were just kind of scary and sensationalized. They would say, don't ever do this, or this is awful, or this will never heal right. And I guess that can happen in very, very small percentages, and I guess that can still happen with me, but I don't feel that way. I feel like that's just sensationalized videos, and I wanted to tell you that I'm not in agonizing pain as long as I take the pain medicine. And I haven't been taking the pain medicine that much. It's pretty spread apart. I take all the other things that they tell me to take, but I feel pretty good. I make sure I eat because it's rough on your stomach and stuff like that, but I'm not in pain. I'm not vomiting. I feel pretty good. So one of the tips and tricks is I bought these slides. They're little Bombas slides. They're called Friday slides, and they're wonderful. I bring them to therapy. I wear them around with the walker. They're easy to slip on and off your feet, and they work beautifully, for swollen feet. So anyway, I think that's about it for today. I just want you to be reassured that if you're coming up to some knee surgery like this, you will be okay, and not to be so frightened ahead of time. Thanks, everybody.